Hi, I'm Dr. Sridhar. There was a question from one of you about the ET tube leak in the small babies and the lack of ability to do volume guarantee in those situations. So obviously in most ventilators there is a leak compensation and up to 40 to 50% leak is still acceptable. But if it goes beyond 40 to 50% leak, it's better not to use volume guarantee. Whether we change the ET tube, upsize the ET tube in these situations depends on two factors. One is the severity of the lung disease, whether you're able to ventilate the lungs adequately, and what your likely course is going to be. Are you going to extubate this baby in the next day or so, or is it going to be a prolonged ventilation? So if the baby is going to need prolonged ventilation, or if the baby is difficult to ventilate and you need high frequency, for example, where the leak will compromise efficacy, it's better to change the tube in a controlled setting in the NICU where you have experienced people to intubate such babies. Remember that in the first 2-3 days you have to be very gentle in the handling, given the IVH prevention bundle and approach to that. So the point to consider here, if the baby is going to be extubated soon, you can just increase the pressure. You can use a mode without volume guarantee, either assist control or SMV with pressure support. Use appropriate pressures that you expect to need, but remember that the leak compensation just means the ventilator is giving a higher pressure. So you can increase the settings accordingly. If the leak compensation is unable to compensate, you give a little higher pressure setting compared to what you would otherwise. Monitor the gas exchange, oxygenation and ventilation of the gas or end-tidal CO2, and wean the baby appropriately after that. So don't take intubation lightly. It can be challenging in the small babies and you might end up in problems, trauma and other complications. So only change the tube if you expect the baby to need a longer term of ventilation. Apart from that, the positioning of the neck changes, and the tube position in the airway, if the head is slightly turned to one side, or the ET's tube holder, how it is fixed as well makes a difference. So request the nursing team to try modifying it a little bit and see if that will help. Look at the graphics, look at the tidal volume delivered, and all these can guide you as well. I hope this helps. Thank you.